If you're 36 weeks pregnant, you are standing right at the edge of one of the most powerful moments of your life. Your baby is almost ready. Your body is preparing beautifully, and everything happening right now, the pressure, the emotion, the excitement, has purpose. This week is extraordinary. Your baby's lungs are nearly complete. The brain is developing at full speed. The body is gaining strength. And maybe, just maybe, your little one has already started to settle into position for birth. In today's video, I'm going to gently walk you through everything that's happening inside your womb at 36 weeks. What's normal, what's reassuring, what your body is preparing for, and how you can feel more confident and calm as the big day approaches. So get comfortable. Invite your partner to watch with. This is a beautiful moment for both of you. And before we begin, don't forget to leave your beautiful like right here below. It helps this video reach other moms who need reassurance. Subscribe to the channel so you don't miss week 37, because next week, your baby will officially be full term. And tell me in the comments, I'm here. I'm 36 weeks, or however many weeks you are today. I love reading each one of your journey. Now, let's talk about what's happening with your baby at 36 weeks. At 36 weeks pregnant, you are standing at a breathtaking milestone. Your baby is no longer tiny or fragile. Your little one is strong, filled out, and beautifully developed. This is the stage where everything starts to feel real. The countdown is no longer abstract. It is tangible, emotional, and very close. Your baby now measures about 17 to 18 inches long and weighs around 6 pounds. That means your womb is holding a fully formed little human with chubby cheeks, tiny fingernails, and growing eyelashes. The body proportions look like a newborn. The transformation from early pregnancy is truly extraordinary. Although 36 weeks is still medically considered late preterm, the difference between now and full term is minimal. Most babies born at this stage do very well. Their systems are functioning, their bodies are mature, and their resilience is impressive. You may feel a mix of excitement and nervous anticipation. That's completely normal. This is the week where preparation meets reality, and your baby is almost ready to meet you. Inside your womb, your baby is no longer floating with lots of room to stretch. Space is limited now. Instead of wide kicks and flips, you may feel rolling movements, stretches, and gentle pushes. These movements are signs of strength and healthy muscle tone. The layer of fat under your baby's skin continues to increase. This fat is important because it helps regulate temperature after birth. It also gives your baby that soft, rounded, newborn appearance you will soon recognize instantly. Your baby's skin, once translucent and wrinkled, is now smooth and pink. The vernix, that protective creamy coating, is gradually shedding. Some of it is swallowed, which helps develop digestion, while some remains to protect the skin until birth. All of these subtle changes are signs of readiness. Your baby is transitioning from growing to preparing. At this stage, your baby's immune system is also strengthening. Antibodies from your body are passing through the placenta, giving your baby early protection. This is one of the many beautiful collaborations between your body and your baby. These antibodies will help protect your newborn in the first weeks of life. Your body has been preparing for this exchange for months, even if you don't see it happening. It is one of the most powerful invisible gifts you are giving. Your baby is also practicing breathing movement. Although oxygen still comes from the placenta, the lungs are rehearsing the rhythm of life outside the womb. Tiny chest movements may even be visible on ultrasound. Every system is synchronizing. Everything is aligning for that first breath. Sleep cycles are more established now. Your baby has periods of deep sleep and active alertness. You may notice certain times of day when movement increases, often at night when you are resting. These patterns are early signs of neurological maturity. The brain is organizing rhythms, processing stimuli, and building connection. This rapid development is why nutrition and rest remain so important in these final weeks. Your voice is familiar to your baby. Sounds from outside are muffled but recognizable. After birth, your baby will immediately recognize the sound that has comforted them for months. Yours. That bond is already deeply formed, even before your first embrace. At 36 weeks, your baby's bones are fully formed, but still soft and flexible. The skull bones are not fused. This is intentional and protective. It allows the head to mold gently during birth. This flexibility is not weakness, it is intelligent design. It helps ensure a smoother passage through the birth canal if you are planning a vaginal birth. The body is also storing iron and nutrients that will support growth after birth. These reserves are important for the first months of life. Your baby is not just ready to be born. Your baby is prepared to thrive. The placenta continues to function as your baby's life support system. It delivers oxygen, filters waste, and transports nutrients with incredible effect. At 36 weeks, it is working hard, but beautifully. You might feel more tired because your body is also working at full capacity. Blood volume remains high, circulation is intense, and oxygen demand is elevated. Even when you are resting, your body is actively sustaining to lives. That is something remarkable. Every deep breath you take supports your baby's oxygenation. Emotionally, this week can feel intense. You may alternate between feeling completely ready and suddenly overwhelmed. That emotional wave is part of the transition into motherhood. Hormones are shifting subtly. Your body is preparing not just physically, but emotionally and neurologically for bonding and caregiving. Trust that this emotional sensitivity has purpose. It is sharpening your instinct. It is preparing your heart. You are not just preparing to give birth, you are preparing to nurture. If your baby were born this week, survival rates are extremely high. Most babies at 36 weeks breathe independently and regulate temperature well. Some may need short monitoring, but outcomes are overwhelmingly positive. This knowledge can bring comfort if you are feeling anxious about early labor. Every additional day inside the womb adds maturity, but you can feel reassured knowing your baby is strong already. You are in a safe and hopeful stage of pregnancy. As space tightens, your baby's movements may feel different, but they should still be consistent. Rolling, stretching, and firm pushes are common. It's important to continue monitoring movement. Your baby may move less dramatically, but not less frequently. If ever in doubt, always contact your healthcare provider. Peace of mind matters. Your awareness is part of your baby's protection. Now you are only 1 week away from full term. That is extraordinary. In just a few days, your baby will be medically considered completely ready for birth. Take a moment to reflect on how far you have come. From a tiny cluster of cells to a nearly 6-pound baby ready for the world, this journey is miraculous. Your body has carried, nourished, and protected life for 9 months. That is strength beyond word. The finish line is near, and you are doing beautifully. At 36 weeks, one of the most encouraging developments is your baby's position inside the uterus. Most babies are now in the cephalic position, meaning their head is facing downward toward the pelvis. This is the ideal position for birth and a powerful sign that your baby is preparing naturally for the journey ahead. Your baby did not randomly choose this. Throughout pregnancy, movements were constant and exploratory. But now, gravity, uterine shape, and instinct guide your baby downward. It is a coordinated biological process between your body and your baby. Seeing or hearing that your baby is head down often brings relief. It confirms that things are progressing in alignment with your birth preparation. It is not a guarantee of immediate labor, but it is a meaningful milestone. Your baby is not just growing, your baby is actively preparing. When your baby moves into the head-down position, space inside your uterus changes significantly. The heavier part of your baby, the head, settles lower into the pelvis, while the legs often curl upward near your ribs. You may feel stronger kicks in your upper abdomen now. At the same time, pressure increases in your lower pelvis. This shift is normal and reflects proper positioning. The head-down posture also helps align your baby's spine with yours. This alignment supports smoother descent during labor when the time comes. Your body and your baby are synchronizing in remarkable ways. Around this time, some babies begin what is called engagement or lightening. Engagement happens when the baby's head moves deeper into the pelvic cavity. This can occur weeks before labor, especially in first pregnancy. For others, it may happen closer to the start of contraction. Both scenarios are normal. When engagement happens, you may feel increased pelvic pressure. Walking may feel heavier. Sitting and turning in bed may require more effort. These sensations are not setbacks. They are signs of preparation. One positive effect of engagement is relief in the upper abdomen. As the baby drops lower, pressure on the stomach and diaphragm decreases. You may notice less heartburn. Breathing may feel easier. Eating might become slightly more comfortable. This physical relief is often one of the first noticeable signs that your baby has descended. Your body creates balance when pressure increases below. Relief often follows above. Engagement also means your pelvis is responding beautifully to pregnancy hormone. The hormone relaxin has been softening ligaments for months. Now, those subtle changes allow your pelvic bones to gently widen and adapt. This is not dramatic movement, but microscopic flexibility that makes space for your baby. Your body has been preparing since the very beginning of pregnancy for this exact moment. Nothing about this process is accidental. It is deeply intentional. You may feel shooting sensations in the pelvis, sometimes called lightning crotch. These brief nerve sensations occur because the baby's head presses against pelvic nerves. Although surprising, they are generally harmless. They reflect how low your baby is settling. Rest, gentle position changes, and slow movements can help reduce discomfort. Your body is adjusting in real time to your baby's position. Not all babies are engaged by 36 weeks, and that is also completely normal. Some babies descend later, even during active labor. If your baby is still slightly higher, there is usually no reason for concern. There is still time. Healthcare providers monitor positioning through abdominal palpation and sometimes ultrasound. Trust that positioning continues evolving right up until birth. If your provider mentions that your baby is at a certain station, they are describing how low the head is in relation to the pelvis. A negative station means the baby is still higher. Zero station means fully engaged. Positive numbers indicate descent during labor. These measurements are simply tools, not deadline. Your baby will descend at the pace that matches your body's readiness. Emotionally, knowing your baby is head down can bring a sense of grounding. It feels like the final chapter is opening. You may start imagining the birth more vividly. The anticipation becomes more real. This is a beautiful moment to connect mentally with your baby and visualize a calm, safe delivery. Preparation is not only physical, it is emotional too. Your baby's position at 36 weeks is one of the strongest signs that birth is approaching, but it does not mean urgency. It means readiness is unfolding naturally. Your baby is aligned. Your pelvis is adapting. Your body is responding wisely. Everything is progressing in harmony. At 36 weeks, your baby's brain is developing at an extraordinary pace. Neural connections are forming rapidly, laying the foundation for memory, learning, and emotional regulation. The brain is not just growing in size, it is organizing itself in complexity. Billions of neurons are being refined, connected, and strengthened. This is one of the most active developmental stages of pregnancy. By the time your baby is born, they will have over 100 billion neurons. These neurons are the building blocks of intelligence and sensation. During these final weeks, the brain's surface becomes more folded. These folds increase surface area, allowing for more advanced processing. Every fold represents growth and potential. Your baby's mind is preparing for the outside world. Omega-3 fatty acids, especially DHA, play a critical role in brain development. This is why many providers emphasize continued supplementation late in pregnancy. DHA contributes to neuron structure and visual development. Continuing prenatal vitamins during this stage is not optional. It is supportive. You are actively nourishing your baby's intelligence. Your baby can now recognize your voice. Neural pathways connected to hearing are well developed. After birth, studies show newborns prefer their mother's voice over unfamiliar sound. That preference is being built right now. You are already your baby's safe sound. Sleep cycles inside the womb reflect neurological maturity. Your baby experiences REM-like sleep patterns. REM sleep is associated with brain development and memory consolidation. Even before birth, your baby's brain is practicing patterns needed for life. Growth continues even during rest. Sensory systems are also refining. Your baby responds to light changes through your abdomen. They respond to touch and pressure. They respond to sound vibration. These sensory responses are guided by brain signal. The brain and body are working as one integrated system. Emotional bonding hormones are influencing brain wiring. Oxytocin exposure helps prepare your baby for attachment after birth. Skin-to-skin contact after delivery further strengthens these neural pathways. Bonding is not only emotional, it is neurological. Love literally shapes the brain. Your nutrition, hydration, and rest directly support this neurological acceleration. Glucose and oxygen delivery through the placenta fuel brain growth. This is why staying hydrated and nourished remains essential at 36 weeks. Your care for yourself is care for your baby's mind. Even stress management plays a role. Calm breathing, gentle movement, and reassurance influence hormone balance. Lower stress hormones promote stable fetal development. This does not mean perfection is required, only awareness. Gentleness toward yourself benefits both of you. At 36 weeks, your baby's brain is not only forming, it is preparing to learn, recognize, bond, and respond. When you hold your baby for the first time, those neural networks will activate instantly. The connection you feel will be mutual and deeply biological. Your baby is not only ready to be born, your baby is ready to connect. At 36 weeks pregnant, your baby's lungs are approximately 98% developed. This is one of the most reassuring milestones of late pregnancy. The respiratory system, which has been forming since early gestation, is now in its final stages of preparation. Although your baby is not yet breathing air, the lungs have been practicing for weeks through rhythmic breathing movements inside the womb. These subtle movements strengthen the diaphragm and chest muscles. The remaining development focuses mainly on surfactant production, a crucial substance that keeps the air sacs from collapsing after birth. This means your baby is almost ready to take that powerful first breath. Surfactant is a thin, protective fluid that lines the tiny air sacs inside the lung. Without it, those sacs could stick together when your baby exhales. By 36 weeks, surfactant levels are typically sufficient for healthy breathing in most babies. Each additional day in the womb increases production. This final stage of lung maturation is quiet but vital. It ensures smoother transition from fluid-filled lungs to air-filled lungs at birth. Your baby's body is completing one of the most important for survival. Even though oxygen still comes from the placenta, your baby regularly practices breathing motion. These practice breaths involve inhaling and exhaling amniotic fluid. This action helps expand lung tissue and build strength in respiratory muscle. It is rehearsal for life outside. Ultrasound exams sometimes show these breathing movements a comforting sign of readiness. Preparation is happening long before the first cry. If a baby is born at 36, the chances of breathing independently are very high. While some newborns may need brief monitoring, most adapt quickly. Medical teams are well equipped to support late preterm babies if needed, but the overwhelming majority transition successfully. This knowledge can reduce anxiety if you are worried about early labor. Your baby is strong and nearly ready. As the lungs mature, the brain and lungs communicate more effectively. Neural signals help regulate breathing rhythm. This coordination ensures that once born, your baby will instinctively know how to inhale and exhale. Breathing is not something a newborn learns. It is something the body is biologically programmed, and that programming is almost fully installed. You may notice your baby having rhythmic movements inside your belly. These are often hiccups. Hiccups are actually signs of diaphragm development and respiratory practice. They show that lung reflexes are working. Although they may feel repetitive, they are usually harmless and healthy. Each hiccup is a tiny rehearsal for life. Your own breathing becomes more important now. Deep, steady breathing increases oxygen supply to the placenta. The more oxygen your blood carries, the more your baby receives. Simple practices like slow breathing, gentle stretching, and rest can support oxygen. Your calm breath nourishes your baby's preparation. If your baby has engaged into the pelvis, you may notice breathing feels easy. As the uterus shifts downward, pressure on your diaphragm decreases. This physical relief is often welcomed in late pregnancy. The same movement that increases pelvic pressure can improve lung expansion. Your body adjusts beautifully in layers. It is natural to feel emotional when thinking about your baby's first breath. That cry marks the official beginning of independent life. But remember, your baby has been preparing for that moment for months. The lungs are ready. The muscles are ready. The reflexes are ready. That first breath will be instinctive and powerful. At 36 weeks, respiratory readiness is one of the strongest indicators that birth is near. Your baby is no longer fragile in development. The systems required for survival are in place. With just a little more surfactant production underway, the lungs are completing their final chapter. Soon, the world will hear that first cry, and it will be strong. At 36 weeks, your baby's digestive system is fully formed and functioning. Although feeding has not yet begun, preparation is actively happening. Your baby regularly swallows amniotic fluid. This swallowing practice helps train the stomach and intestine. Each swallow stimulates digestive movement, known as peristalsis. This is how your baby's body rehearses for breast milk digestion. Inside the intestines, a substance called meconium is accumulated. Meconium is the baby's first. It is thick, dark, and sterile. It forms from swallowed amniotic fluid, shed skin cells, and digestive secretion. Meconium is not waste from food. It is a natural byproduct of fetal development. Its presence shows the intestines are active and working properly. The liver is also mature. It helps process nutrients and store essential elements like iron. These iron stores will support your baby in the first months of life, especially if breastfeeding. The pancreas is preparing to regulate blood sugar levels. Each digestive organ is coordinating for life outside the womb. If your baby were born now, the digestive system would be capable of processing breast milk. The enzymes necessary for milk digestion are already present. Although feeding patterns take practice after birth, the biological readiness is there. Your baby's stomach may be small, but it is fully functional. You may notice that your baby responds after you eat. Movements sometimes increase following meal. This is partly due to changes in blood sugar and energy. Your baby senses these shifts and reacts. Even now, you and your baby are connected through nourishment. The swallowing of amniotic fluid also supports lung development and coordination between breathing and digestion. These systems work together closely after birth. Suck, swallow, and breathe coordination will begin immediately when breastfeeding starts, and the foundation for that coordination is already established. After birth, meconium will be passed in the first 24 to 48 hours. This is an important milestone. Healthcare providers monitor this to ensure digestion and bowel function are normal. In most cases, this process is smooth and expected. It is simply the final step of preparation, transitioning into action. Your nutrition continues to matter deep. Nutrients cross the placenta and support organ maturity. Protein, iron, hydration, and balanced meals all contribute to digestive. Even in the final weeks, your body is building reserves for your baby. You are still nourishing development every single day. Some mothers worry about meconium being passed before birth. While this can happen occasionally, it is not the norm. Your healthcare team monitors amniotic fluid and fetal well-being carefully. Most babies retain meconium until after delivery. Trust that your provider will guide you if any concern. At 36 weeks, your baby's digestive system is not waiting. It is rehearsing. Swallowing, processing, storing, and coordinating are all happening quietly. By the time you hold your baby and begin feeding, the body will already understand what to do. Your baby is prepared not just to breathe, but to be nourished and grow. At 36 weeks, your body is not just carrying your baby, it is actively preparing for birth. One of the most important contributors to this preparation is a hormone called relaxin. This hormone has been present since early pregnancy, but its effects become more noticeable now. Relaxin softens ligaments and increases flexibility in the pelvis. This process allows your body to gradually create space for your baby's passage. Nothing is happening suddenly or randomly. Your body has been orchestrating this preparation for months. Every ache and shift has purpose. The pelvis is not a rigid structure. It is a dynamic ring of bones connected by ligaments and joints. As relaxin works, those ligaments become more elastic. This elasticity allows subtle widening of the pelvic bones. The changes are small in measurement, but powerful in function. You may not see this change, but you can feel it, especially when walking or turning in bed. Your body is adjusting intelligently. Pelvic pressure is very common now. As your baby descends, the weight rests lower, increasing sensation in the lower abdomen. You may feel heaviness between your legs or a sense of fullness deep in the pelvis. This pressure is often stronger if your baby has engaged. It is a sign that birth preparation is advanced. Turning from side to side in bed may feel more difficult. Sudden movements can cause sharp twinges or brief pulling. These sensations are usually ligament-related. Because ligaments are looser, they react more quickly to position changes. Moving slowly and using your arms for support can help. Gentleness is your best strategy. Lower back discomfort may increase during this stage. As your center of gravity shifts forward, your spine compensates. The muscles along your back work harder to support your growing uterus. Stretching, warm compresses, and supportive pillows can bring relief. Your discomfort reflects adaptation, not damage. You may also notice a change in how you walk. Many women develop a slower, wider gait. This is sometimes called the pregnancy waddle, and it happens because the pelvis is widening. It is not clumsiness. It is structural adjustment. Your body is creating space step by step. Some women experience pubic symphysis pain, discomfort at the front of the pelvis. This happens when the joint at the center loosens slightly more than usual. Rest, pelvic support belts, and avoiding uneven weight distribution can help manage it. Pain here is common, but it is usually temporary. Despite these changes, your body is remarkably strong. Ligament softening does not mean instability. It means readiness. The muscles around your pelvis continue to provide support. Your body balances flexibility with strength. This combination is what allows birth to happen safely. Emotional. Feeling these changes can make labor feel very close. You may become more aware of your body than ever before. This awareness is part of the transition into motherhood. You are becoming attuned to signals and your instincts are sharpening alongside your body's preparation. At 36 weeks, pelvic changes are not a sign that something is wrong. They are evidence that everything is aligning for birth. Your ligaments are softening. Your bones are adjusting. Your baby is descending. Your body is preparing exactly as it was designed to. If you feel like you are living in the bathroom at 36 weeks, you are not alone. Increased urination is one of the most common symptoms of late pregnancy. As your baby's head settles lower into the pelvis, it presses directly on your bladder. Even small amounts of urine can create the sensation of urgency. This is mechanical pressure, not a problem. Your bladder has less room to expand now. What once held a comfortable amount of urine feels full much faster. That means more frequent trips, even during the night. Interrupted sleep can be frustrating, but it is a normal part of your body is adapting to reduced internal space. You may also notice mild leakage when coughing, sneezing, or laughing. This happens because pelvic floor muscles are under increased strain. Hormonal relaxation combined with pressure makes those muscles less resistant. This is common and usually temporary. Pelvic floor exercises, such as Kegels, can help strengthen support muscle. Practicing controlled tightening and releasing builds resilience. These exercises are gentle but effective. They also support postpartum recovery. Even though urination increases, it is very important not to reduce fluid in. Hydration supports amniotic fluid levels and blood circulation. It also helps prevent urinary tract infection. Drinking water remains essential. If you notice burning during urination, fever, or unusual discomfort, contact your healthcare provider. While frequent urination is normal, pain is not. Distinguishing between pressure and infection is important. Trust your instincts if something feels different. As baby drops lower, you may notice relief in other areas. Heartburn may improve. Breathing may feel easy. This trade-off, less rib pressure, more bladder pressure, is very common. Your body redistributes space strategically. Frequent urination can also be a subtle preview of newborn life. After birth, you will wake often, feed and care for your baby. Although different, this rhythm shift begins now. Your body is gently preparing you for change. Emotionally, constant bathroom trips can feel exhausting. Be patient, slow down, rest when possible. Small inconveniences now are part of a much bigger journey. Your body is making room for life. At 36 weeks, increased urination is not a warning sign. It is a positioning sign. Your baby is lower. Your bladder is compressed. Hydrate, strengthen gently, and move carefully. Your body is adjusting beautifully for the final stretch. At 36 weeks, many mothers begin searching for natural ways to gently support labor preparation. One food that has gained attention is the date fruit. Dates have been traditionally consumed in late pregnancy in various cultures. Research suggests that eating dates in the final weeks may help support cervical ripening. Cervical ripening means the softening and thinning of the cervix in preparation for dilation. This does not force labor. It supports readiness. Natural preparation is about support, not acceleration. Dates are rich in fiber, antioxidants, and natural sugars. They also contain minerals such as potassium, magnesium, and iron. These nutrients support energy levels and digestive health during late pregnancy. Labor is physically demanding. Having steady energy reserves is beneficial. Dates provide concentrated nourishment in a small portion. Some studies indicate that women who consumed approximately 6 dates per day, starting at 36 weeks, experienced shorter early labor phase. It is important to understand this does not guarantee faster birth. It simply suggests improved cervical softness and responsiveness. Your body still determines the timing of labor. Dates contain compounds that may influence prostaglandin activity. Prostaglandins are substances involved in cervical. This does not mean dates induce contractions directly. Rather, they may enhance the body's natural labor mechanisms once labor begins. Preparation is not the same as initiation. If you choose to include dates in your diet, consistency matters more than quantity. 6 dates per day is the amount most commonly referenced. They can be eaten plain, blended into smoothies, or chopped into yogurt. Small daily habits can support larger biological processes. However, if you have gestational diabetes, you must consult your healthcare provider before increasing Dates are naturally high in sugar. Blood glucose balance remains essential in late pregnancy. Individualized guidance always comes first. Beyond labor preparation, dates support digestion. Their fiber content may help reduce constipation, which is common at 36 weeks. Comfort in digestion contributes to overall well-being. Feeling lighter can improve rest and mobility. Nutrition influences more than just labor. It is important to approach natural remedies with calm perspective. Dates are supportive, not magical. Labor will begin when your body and baby are ready. Food can assist, but it does not override biology. Including dates can also feel empowering. It gives you a sense of participation in preparation. Small rituals during pregnancy strengthen confidence. Confidence reduces fear, and calmness supports labor hormones. Preparation is both physical and psychological. At 36 weeks, adding dates to your diet can be a gentle, nourishing choice. It may support cervical readiness and energy levels, but remember, your body already knows how to give birth. You are supporting a process that is already beautifully. At 36 weeks, travel, especially air travel, requires careful consideration. Your baby is larger, oxygen demands are higher, and labor can begin unpredictably. Most healthcare providers recommend avoiding flights after this stage. Stability and proximity to your birthing location become priorities. Airplane cabins are pressurized, but oxygen levels are slightly lower than at ground level. For most healthy individuals, this is not a problem. However, in late pregnancy, your oxygen needs increase significantly. Your baby depends entirely on your oxygen supply. Reduced oxygen saturation during flights is typically mild, but combined with long sitting period, it can increase discomfort. Swelling in hands, feet, and ankles may worsen. Circulation slows when seated for extended periods. Comfort becomes harder to maintain. Airlines often require medical clearance after 28 weeks. After 36 weeks, many airlines decline boarding altogether. Policies vary, but they aim to prevent in-flight labor. Unexpected labor, mid-air presents medical limitations. If you have high-risk conditions such as hypertension, gestational diabetes, or anemia, travel restrictions may apply earlier. Your provider assesses individual risk carefully. Personal medical history determines safety. There is no universal rule for everyone. Traveling by car also requires planning. Frequent stops to stretch and hydrate are essential. Compression stockings may help reduce swelling. Movement supports circulation. Stress levels often increase during travel. Elevated stress hormones can influence blood pressure and comfort. At 36 weeks, minimizing stress is beneficial for both mother and baby. Calm environments promote stability. Being close to your chosen hospital or birth center provides peace of mind. As labor approaches, quick access to care is reassuring. Late pregnancy is a time for nesting, not long-distance journeys. Stability supports emotional security. If travel is unavoidable, communicate clearly with your provider. Carry medical records and emergency contacts. Plan conservatively rather than optimistically. Preparedness reduces anxiety. At 36 weeks, your focus shifts from mobility to readiness. Travel becomes less important than rest and proximity to care. This is not restriction, it is protection. Your body is entering its final chapter of preparation. At 36 weeks, preparation extends beyond the physical body. Now is the time to finalize practical and emotional plans. Having clarity reduces anxiety. Structure creates peace. A birth plan allows you to express your preferences clearly. It communicates your wishes regarding labor, delivery, and newborn care. Medical teams value clarity. Prepared communication prevents confusion. A birth plan is flexible, not rigid. Labor is dynamic, and safety always comes first. But documenting your preferences empowers. Empowerment reduces. Understanding maternity leave rights helps you prepare financially and emotionally. Knowing how much time you have allows realistic planning. Financial clarity supports mental calmness. Planning reduces last-minute stress. If you are self-employed, advanced organization is essential. Setting aside savings and adjusting workload early helps ease transition. Postpartum recovery requires rest. Rest supports healing and bonding. Paternity leave also plays an important role. Support during the early days reduces maternal exhaustion. Shared responsibility strengthens family bonding. Preparation benefits both parents. Emotional. This stage may bring fear about labor. Fear of pain, surgery, or the unknown is natural. Acknowledging fear reduces its power. Education replaces uncertainty with clarity. Visualizing a calm birth can positively influence stress hormone. Breathing exercises and affirmations support emotional regulation. Confidence influences physiological response. Calmness promotes smoother labor progression. Bonding begins before birth. Talking to your baby, imagining their face, preparing their space, all strengthen connection. Emotional readiness enhances postpartum adjustment. You are already becoming a mother in deeper ways. At 36 weeks, preparation is nearly complete. Your baby is ready. Your body is ready. Your plans are aligning. Trust your strength. The next chapter is about to begin, and you are prepared.